What are you going to do?
Bill.
Some of the doctors say that there's no proof that vitamins, supplements are necessary.
The answer to that is pretty simple. Again, that expression, you due diligence. If a tree falls in the forest and nobody's there to hear it, doesn't make a sound. If you don't look, me personally, 6 years ago, I would agree with that statement until I started looking. And there's tens of thousands of articles that are written every year documenting the positive effects of nutrition, antioxidants, vitamins, minerals. There's over 60 years of research from the Packard lab at UCLA Berkeley on the health benefits of antioxidants. And there's always going to be naysayers, but we know the literature is replete with double-blind studies, just like double-blind studies on pharmaceuticals. There are double-blind studies on nutraceuticals corroborating that we are affecting significant positive health changes.
One of the things I hear is that there's some studies out that say supplements actually cause problems like cancer.
I want you to answer that.
What I found is that when you look at these studies, all the studies are on synthetic supplements, and they're isolated. And when you do a study based on isolated synthetic supplements, I personally don't want to take isolated synthetic supplements. I want to take a supplement based on natural products, based on 10 to 12 servings of fruits and vegetables in a comprehensive package, because that's how nature intended it to be. And if you're taking nutrients together in a comprehensive way, there's been no proof that that hurts you. The same way there's no proof that having fruits and vegetables hurt you. So I think that, and if you take a look at the studies, when I was in Journal Club, if you look at 80% of the studies out there, the validity of them is very much in question. And you could make data appear any way you want.
Put it this way, very simply. Over the last 60 plus years, there are enough well-designed, double-blind peer-reviewed studies to support that if you're giving the patient proper nutrition and supplements that are not contaminated, that you're getting the job done. Hey, Dr. Rosenberg, if I start this now, how long do I have to take these?
Well, I answer them however long you want them to work for. Just like exercise. You stop exercise, it stops working. You stop eating, it stops working. Supplements are a food product. They're an FDA classified food product. And the purpose of that is to provide you with nutrients. So I recommend taking it twice a day because the water-soluble supplements need to be around, and if you only take it once a day, you're only going to get it half the time. So all these supplements are recommended twice a day for that.
Exactly.
If some doctors are concerned about the patient flow, that the patient flow will be interrupted.
We have built in and evolved over the last 6 years that Dr. Rosenberg and I have been doing this, an implementation program that is going to be basically staff-driven. And if it's important to you, it's important to be able to implement that program into the practice so it doesn't disrupt your practice and adds beneficially to your patient's health.
And we know that if patient flow is interrupted, it's not going to work. Because the primary reason for the doctor's practice being open is to take care of patients. And it's not until the value of this whole scanner program with the use of the supplements is given a value, that's when it gets incorporated into the patient flow. So we don't want it to interrupt patient flow, we want it to become part of it.
I tell physicians, if there was a pharmaceutical drug that came out yesterday that was guaranteed to improve your patient's health, you would find the time to write that prescription and describe what it's going to do. So if you as a physician are not going to embrace nutrition, you're not going to embrace the ability to measure nutrition, and you're not going to embrace this program, don't get started. You must take ownership of this, and you must have the belief system that these two physicians sitting here have.
Yeah, ownership is key. Without the physician taking ownership and really believing that this is going to be beneficial, it doesn't work. Because what the physician believes, the staff will believe. That's the way it works. You know, sometimes I hear doctors that have tried this before. They actually had the scanner in their office years before and it didn't work. And you ever hear that?
I hear that a few times, and there's a bunch of different reasons for that. One of which is what we just discussed. They really didn't take ownership of it. The scanner was there, and it served more or less as a paperweight, collected dust. If you're not using it and you're not exposing your patients to it and you haven't implemented it properly, it's not going to get done. It also might be that the people that they got involved with didn't really show them and implement it properly. And so I always offer them a program that is going to help make them more successful, and we have that group of physicians and we're making it more successful.
Yeah, it's all about the system that you put in place to make it work and the protocols that you put in place.
Protocols, absolutely. You know, Dr. Rosenberg, I really, I don't believe that scanner works.
When I looked at this myself, I go through the thought process with each physician with the same thought process I went through. Number one, the science has to be real. So the science of that scanner can be looked at through the literature. It's very simple. We have plenty of papers that explain how it works, why it works, and the benefits of it. And when that gets explained in writing, there's no disputing it.
For me, it was a realization of reading this 26-page report called the Cady Report. That really put it together for me in terms of how this instrumentation came about, the history behind it, and that led me to read more about it and to Google it and to research it. And once I did, it was a natural fit.
You know, one of the objections I get also is that scanner is nothing more than a way for the company to promote their products.
Well, we have the only company that I'm aware of that guarantees their products, and this instrumentation had absolutely nothing to do with our products or our company. It's a nutritional, give me a second, it's a nutritional report card, and as it evolved, it certainly helped it certainly helped diagnose whether, no, I don't like that. Skip that.
Yeah.
Answer that one.
Ask the question again.
Why don't you ask me the question? I made it up.
What was the
It
question?
wasn't there. I
Yeah,
made
what
it
was
up.
the question?
It was the, that scanner is nothing more than a way to
That-
sell your own supplements.
Mm-hmm.
Dr. Rosenberg, to me, that scanner is nothing more than a way for you to sell your products, your supplements.
You know, the knee-jerk reflex would be that that's the justification. That scanner is not owned by Pharmanex Nu Skin. It's actually owned by the University of Utah. They did it in collaboration with the Moraine Eye Institute, studying macular degeneration. And in the process of that, about an hour down the road was this Pharmanex company, and they learned about this research, and they purchased the medical rights to use that information, to use that scanner, and to redevelop it from the size of a small room to the size of a football in order to measure carotenoid levels in the hand that correlated with the carotenoid levels in the retina. And to this day, every time that scanner is used, University of Utah gets a commission on it because it's not owned by Pharmanex.
And what I tell patients, it's just a way to corroborate if your lifestyle, including everything that lifestyle includes, is getting the job done. And if it's not, again, let me say it again, we can supplement, but it's not a substitute. So this isn't a way just to organize your practice and produce supplementation for your patients. It's a way to first evaluate whether, before you even walk in the door with anything, whether what you're doing is working. And it's not just a test of our products, it's a test of others. Now I have patients that say, I don't want to take a supplement. I'm going to eat more servings of fruits and vegetables. I'm going to stop smoking. I'm going to go on a better nutritional plan. And I'm going to come back in 60 days. I'm going to see if that gets the job done.
And I applaud that, because if they change their lifestyle and eat better and the score gets better, I'm thrilled. People come in all the time with scores off the charts because of the way they eat, and I say, you keep doing what you're doing. And that's perfect.
We have anything else? Any issues we haven't?
The profit thing, I guess that was already addressed.
Yeah. Yeah, that's why I skipped it.
Good.
Okay.
Eduardo,
Yes.
anything you want us to repeat?